Hi there, I'm Dr. Stephen Phelan. Welcome to this video. What I would like to share with you today is some information about dental implant treatment from start to finish, all in one dental practice, right here in Oakville and Toronto, Ontario. So if you're interested in having dental implants completed and having dental implant treatment and the benefits of dental implants, which would be, a better smile, better ability to chew, no missing teeth. If you have dentures, much better chewing experience and quality of life. If you're interested in dental implant treatment, then I'd invite you to come look at my dental practice, look over my website, come in for a consultation and talk to us, and find out about our unique technique for treating dental implants. As I said, with my dental practice, I've developed a technique to do dental implants completely from start to finish right here in my practice. And I'm using a special technique with flapless, computer-guided dental implant surgery. So what we do is we have the patient come in and have a CT scan of their jaw. I send you to an oral radiologist for that. And then we take the CT scan and I plan out the implant position based on your restorative needs and your available bone, your biology. And I'm able to figure out an ideal position for your dental implant. And as long as you have adequate bone levels, we can place your dental implant using a flapless technique right through a tissue punch, through a small hole in your gums, as opposed to flapping your gums back and having to put in a lot of sutures. So if you look at this photo here, basically this is a photo of a typical dental implant treatment or a typical dental implant placement. And in this photo, you can see all the sutures, and basically the patient had their gums flapped back so that they can evaluate the bone and place the dental implant. And if you don't have adequate bone levels, this is the technique that you need to follow for placing dental implants. But with the CT scan, I can tell whether or not you have adequate bone levels. And if you have adequate bone levels, there's really no need to have your tissue reflected back like this and have all these sutures placed. And these photos are from a periodontist who treated this patient in my office, and he does excellent work. This is beautiful suturing and beautiful dental work. But again, if you don't need it, there's no need to flap back your tissue and have all of this surgical technique used. So with the technique that I'm using, we basically do a little tissue punch, a little 3 to 4 millimeter diameter tissue punch that we take that little bit of tissue out and we drill the implant through that with a surgical guide that's made from our Implant or our computer generated CT guide plan that we create in the dental software. So if you look here, this is basically the CT scan of a patient as well as the planning for the dental implant. So you can see my dental implant positioned, and basically then what I do is I have a guide made which allows me to just drill the dental implant through a small hole in your gums. And here's one of the patients that I've treated in the last couple of years. And this patient was a 20-year-old male who was missing his lateral incisors. And he had temporary teeth placed there after orthodontics. But now he was at an age where he had stopped growing and he was ready to have the dental implants placed. And the nice thing about this technique is you can also, if the bone is adequate and strong enough, you can also place a temporary crown on the dental implants at the time of surgery. So the patient walks in with no teeth and walks out with teeth. And the temporary teeth can last easily a year. 6 months to a year is no problem with these temporary implant crowns. I've had a number of patients have them in for a year. And the reason we do these is at the front of the mouth, you want to guide and mold the gum tissue. So you want the gum tissue to be as ideal as possible. And with the temporary crowns, you can influence the gum tissue so that it's ideal when we place the final crowns. And if you look, here's a picture of the surgical guide in place. And all I do is I essentially drill through the surgical guide to place the implant. So it's a very conservative surgery. You know, my patients who have this type of surgery completed all tell me that the next day they almost feel like they had nothing done. They feel a little bit of a pinch where the freezing was more than where the implant was placed. So it's a really great technique for people who are thinking about dental implants. And if you look at this next picture, this is the picture immediately after implant surgery, and I've placed the temporary posts in place. They're called temporary abutments, which we use to build the temporary crowns. This patient, we evaluated the bone levels and the stability of the implant, and it was very stable. Both of them were very stable, so we placed the crowns right at that point in time. And if you look, here's the image with the temporary crowns in place. And basically, I did a little soft tissue graft on the one crown using the tissue that I had punched out to place the implants. So it's a nice way to conserve tissue and do a very conservative soft tissue graft. And then the next picture is basically 1 week post-treatment. You can see how good the healing is. It looks amazing, really, compared to traditional implant surgery with flaps. And then here's before and after. And this patient's been in the provisional crowns for a year. He's away at school, and we don't have to do the final crowns right away. Because of the technique that we're using, the provisional crowns can really last a long time. So those are the provisional crowns. Couple more views of the provisional crowns. When we do his final treatment, we're actually going to treat the dark central incisor with some internal bleaching and a porcelain veneer. He has a root canal on that tooth, and it needs some restorative treatment just to make the whole smile look better. And my plan is to make the lateral incisors a little longer. Usually when we initially place implants in a provisional crown immediately on implants, we want to keep it out of the bite, so we make them a little shorter and a little thinner. But with final restorations, after the implants have been integrated for a year, even after they've been integrated for 2 or 3 months, you can make them full-sized. So that's basically dental implants from start to finish right here in Oakville and Toronto, Ontario. We have patients from all across the GTA coming in to see me, and I treat dentists from across Ontario. I think the furthest dentist that came to see me was from Ottawa, maybe. He flew in from Ottawa a number of times to complete his treatment. And we've had people fly in from Bermuda. I've had a number of people fly in from Bermuda for treatment as well. So anyway, thank you for joining me on this video. And if you have any questions, call our office or send me an email. Thank you.